Welcome to my channel. In this video I will discuss thyroid ophthalmopathy. What is thyroid ophthalmopathy, also known as Graves ophthalmopathy and also known as thyroid eye disease? It is an autoimmune inflammatory disorder of the orbit and periorbital tissues characterized by upper eyelid retraction, lid lag, swelling of the eyeball and redness, erythema, conjunctivitis and bulging of the eyes. It is known as exophthalmos. Cause. It is obvious the cause, as the name indicates, is in thyroid. So it occurs when the body's immune system attacks the tissue surrounding the eye, causing inflammation in the tissues around and behind the eye. In most patients, the same autoimmune condition that causes TED also affects the thyroid gland, resulting in Graves' disease. So the antibodies that are formed against the thyroid gland are also formed against the tissues surrounding the eye, and it leads to ophthalmopathy. Here you can see that these are cytokines, for example interferon gamma and TNF alpha. These bind to the specific antigens on the orbital fibroblasts. Here you can also see the antibodies also bind with the orbital fibroblasts, and differentiation occurs and orbital adipocytes start accumulating and orbital tissue starts expanding. So this orbital tissue when expands, then it leads to exophthalmos. Then there is increased production of hyaluronic acid, and as a result of this the extraocular muscles also show enlargement due to deposition of this hyaluronic acid. Furthermore, myofibroblasts are when activated, then fibrosis occurs. Here you can see this sign indicates T lymphocytes and this sign indicates antibodies. So it is an autoimmune response. In this, adipose tissue is expanded and extraocular muscles are enlarged and fibrosis occurs. Symptoms that occur in thyroid eye disease include dry eyes, watery eyes and red eyes, bulging eyes that lead to a condition known as stare. The person has a staring look, and double vision can also occur. Research suggests that the cause of thyroid disease and thyroid eye disease is an autoimmune disorder. I have told you this. Here you can see upper eyelid signs. These are most obvious signs and help in diagnosis of thyroid ophthalmopathy. These are von Graeff's sign. In this, when you look downwards, then lid legs, upper lid legs behind on down gaze. Then the next sign is Dalrymple's sign. In this, lid retraction occurs. Then Stellwag's sign, incomplete and infrequent blinking occurs. Then Grove sign, that is resistance to pulling the retracted upper lid. Then Boston sign, that is jerky movements of the lid on down gaze. Then Gallinac's sign, abnormal pigmentation of upper eyelid. And then Gifford's sign, difficulty in everting the upper lid. Among these you should remember these signs: von Graeff's sign, that is lid lag on down gaze; Dalrymple's sign, lid retraction; Stellwag's sign, that is incomplete and infrequent blinking; and Gifford's sign, difficulty in everting the upper lid. Werner's classified the thyroid ophthalmopathy in different grades on the severity. So these are class 0, no signs or symptoms; class 1, only signs, that is lid retraction; then class 2, soft tissue involvement; then class 3, proptosis; class 4, extraocular muscle involvement; class 5, corneal involvement; and class 6, sight loss, optic nerve involvement. So no specs is the mnemonics to understand the Werner's classification. No specs. How it is treated? It is treated by applying cold compresses to the eyes, wearing sunglasses, lubricating agents are used, elevating the head of your bed, and prisms are used if double vision is a problem. Steroids are given to decrease the inflammation, and eyelid surgery is indicated to correct the eyelid conditions, and extraocular muscle surgery is also done. Furthermore, the underlying cause is also, I have told you that hyperthyroidism. So hyperthyroidism is also treated, and cyclosporin can also be given to reduce the autoimmune response. Cyclosporin can also be given to reduce the autoimmune response. This is all about thyroid ophthalmopathy and its treatment. Thank you for watching.